There are third-line therapies that are approved by the FDA, and there are 3 of them. The first one is called InterStim, which is kind of like a pacemaker for the bladder, in that it has a battery and a lead, but the way that it works is it stimulates the nerve that goes to the bladder, and if it works, then we implant it. So most people are familiar with people who have a pacemaker and a lead that goes to the heart. The difference is that the battery is in your buttocks cheek, and it goes down to the S3 nerve, which is the nerve that goes to the bowel and the bladder. We always do a test in the office to see if it's going to work, because we never can predict who it's going to work for, but it works for 2/3 of people. If it's a successful test, then we implant the full thing in the operating room. If it's not a successful test, then we go on to other things. The second one is Botox. Everybody's familiar with Botox, that you can inject it in the face and get rid of wrinkles. Well, we now can inject it into the bladder as well. It's been FDA approved for several years now. Now, the way that that works is it partially paralyzes the bladder. So that will give you more time to get to the bathroom, will give you larger bladder capacity. The pros and cons of it are it's not permanent, just like Botox that you inject into your face, it wears off. It does last at an average of 6 to 12 months. Most of my patients go closer to 12, except for the patients who have really severe symptoms. But insurance will pay for it as long as it's been 3 months. The other side of it is that I always counsel patients that if we do Botox, you have to be willing to take the risk that you might not be able to urinate afterwards, because we're trying to paralyze the bladder partially, but we can never predict exactly how far down that scale we go, and sometimes people's residuals will go up and they have to catheterize temporarily. That happens rarely, but I always have to counsel people that that may happen. And then there's an office-based procedure called percutaneous tibial nerve stimulation. It kind of uses the same science as InterStim in that it's stimulating a nerve, working at it from the nerve, but what we do is we access the tibial nerve, which is down here by the ankle, for 30 minutes once a week for 12 weeks in the office.